Okay, so today we're diving right in, going deep on how certain vitamins could actually help you manage diabetes better.
Right.
You shared some interesting information focusing on 5 key vitamins,
Uh-huh.
and we're really trying to figure out what makes them so potentially beneficial for people dealing with diabetes.
Yeah,
Our goal is to make all this information as clear as possible and give you the most useful takeaways.
absolutely.
So the information you gave us covers vitamin D, B6, B12, C, and E.
Right.
And we're going to explore how they might be good for you and what you should keep in mind if you have diabetes.
Exactly.
Okay, let's start with vitamin D.
Okay.
Your information suggests it might have something to do with regulating insulin levels.
Right.
Now, that's really interesting, especially when you consider the connection between low vitamin D and a possibly higher risk of type 2 diabetes.
Hmm.
We know you can find it in sunlight, fatty fish, fortified milk, and of course, supplements.
Yeah.
So what's the connection here? What's going on?
Well, what's fascinating is how it might actually work. Some research suggests that vitamin D could affect how sensitive your insulin receptors are,
Interesting.
and even the function of those pancreatic beta cells that are actually making the insulin.
Yeah, okay. Yeah.
So keeping those levels up could be helpful for healthy insulin regulation.
Right. So beyond insulin, another big thing for managing diabetes is nerve health,
Absolutely.
which brings us to vitamin B6.
Yeah.
This one is known for helping with metabolism and nerve function.
Right.
Really crucial because diabetes can sometimes lead to neuropathy, nerve damage.
That's right.
Good news is you can find B6 in things like poultry, fish, potatoes, chickpeas, bananas.
Very common foods.
Yeah, very common foods,
Yeah.
so that's easy to get.
Yeah, it really highlights how these vitamins can be so important for keeping your body working properly, especially when you're managing diabetes.
Absolutely, yeah. Okay, next is B12, another important one for nerve health and potentially stopping that nerve damage.
Mm-hmm.
Now, here's a really important point, metformin.
Yes.
A common medication for diabetes can actually affect your B12 levels.
Yeah, this is really important for people to be aware
This
of.
is so important. You want to be aware of that for sure.
Absolutely.
You can get B12 from meat, dairy, eggs, and some fortified cereals.
Right.
So how does that work? How does that medication affect B12?
Well, metformin can sometimes mess with how well your gut absorbs B12,
Okay.
and that can lead to a deficiency for some people.
Oh, wow. So that's a huge reason to get those regular checkups.
Exactly, and be aware of any potential side effects.
Absolutely. Okay, let's move on to vitamin C.
Sure.
The famous antioxidant information suggests it might help prevent some of those complications from diabetes.
Right.
We're talking about things like oxidative stress, which is damage to your cells caused by these unstable molecules.
Yeah.
And luckily, vitamin C is in a ton of delicious things. Citrus fruits, strawberries, bell peppers, broccoli.
Right.
So those antioxidant properties of vitamin C are really valuable.
They really are.
Like you were saying, they can help protect those cells from damage that can happen over time with diabetes. Okay, last but not least, vitamin E,
Okay.
another antioxidant.
Yep.
But this one might also be linked to better insulin sensitivity.
Right.
Plus, it's good for heart health, which is a huge thing when you're managing diabetes.
Absolutely.
And you can find vitamin E in things like nuts, seeds, spinach, and vegetable oils.
Yeah, those are some great sources.
So once again, those antioxidant effects are so helpful.
They really are.
And that link to better insulin sensitivity, that's really interesting
It is.
because it could directly affect how your blood sugar is managed.
Exactly.
Okay, now this is so important before you even think about taking any vitamin supplements, especially when you're already managing diabetes.
Well,
You have to talk to your doctor.
you absolutely have to.
They know your health history
Mm-hmm.
and can give you personalized advice and make sure there aren't any problems with your current medications.
Absolutely.
So that's the most important thing to remember here.
I agree.
Vitamins can be helpful, but you need to consider them as part of your individual needs with professional guidance.
Couldn't have said it better myself.
And just to be super clear, these vitamins are here to support your overall health.
Yeah.
They are not a replacement for a balanced diet, regular physical activity, and keeping track of your blood sugar.
That's right. Those are still the most important things.
Those are the cornerstones of managing diabetes effectively.
Absolutely.
So think of vitamins as like allies in your overall plan,
Right.
working alongside those good habits.
Yeah, good analogy.
So the key takeaway is this. While these vitamins might offer benefits for people managing diabetes,
Uh-huh.
always talk to your doctor before taking any supplements.
Always.
They can give you personalized advice based on your specific situation and medical history.
Exactly.
Informed decisions made with your healthcare team are always the best way to manage your health.
I completely agree.
Now, here's something to think about.
Okay.
Given how closely nutrition and diabetes management are tied together, what other parts of your daily eating habits might be having a bigger impact than you realize?
That's a great question.
It's something interesting to explore further.
Yeah, I think so too.
Thanks for diving deep with us today.
My pleasure.
We'll see you next time.
See you then.